In this module, we're going to examine the lower limbs of a trauma patient. Be structured and systematic, as this will help you to avoid missing injuries. Before starting the examination, ensure that the patient is stable and comfortable. Wash your hands and use PPE as appropriate. We recommend using the look, feel, test system of examination. Ensure there is adequate lighting. Commence the examination by looking at the lower limbs. Expose the lower limbs in a position of comfort. It may not be possible to perform the entire examination if the limb is already immobilized in plaster. Instead, just examine what you can. Inspect the soft tissues for swelling, noting whether this is local or diffuse, as well as any gross deformities, wounds, bleeding, or foreign bodies. Look for any abnormal color and compare both sides, noting any asymmetry. Next, we can assess vascularity by feeling the limb for its warmth from proximal to distal, noting any sharp demarcation. Check the capillary refill time, which should be under 3 seconds. Palpate the peripheral pulses. Work your way from the hip to the toes and feel along the length of the bones for any bony tenderness or crepitus. Feel the compartments of the leg and lower leg to ensure they are not tense. Palpate the joints, checking for tenderness or effusions. As before, compare both sides, noting any asymmetry in findings. Test the passive range of movement by working your way through each joint from proximal to distal. Pain with passive stretching, along with tense compartments, may indicate a compartment syndrome. Next, test the active movements of the lower limb. Observing gait and weight bearing is a good screening test and can help localize injuries. This is a screening examination, so if there is a problem with a specific movement, as indicated by pain or restriction, then focus on that area more thoroughly. Testing resisted movements through each joint is a good test of the mechanical apparatus at each joint. After this, we will test the specific nerves of the lower limb. You can test the femoral nerve by checking resisted hip flexion and knee extension. Check the sensation over the anteromedial thigh. Next, test the sciatic nerve by checking resisted hip extension and knee flexion. Check the sensation over the posterior leg. Next, test the tibial nerve by checking resisted ankle plantar flexion and toe flexion. Check the sensation over the calcaneal area and sole of the foot. Next, test the deep fibular nerve by checking resisted ankle dorsiflexion and inversion and checking the sensation in the first dorsal web space. Then test the superficial fibular nerve by checking resisted ankle eversion and checking sensation over the dorsum of the foot. The final two nerves are purely sensory nerves. You can test the sural nerve by checking sensation over the posterolateral leg, lateral malleolus, and lateral foot. The saphenous nerve can be tested by checking sensation over the medial leg and medial malleolus. That concludes lower limb testing. To finish off the examination, always document your findings in the health record. Abnormalities in examination should be reviewed with a senior colleague, and specialist referral may be appropriate depending on the injury. Consider the functional impact of the injuries and update the patient's ACC and insurance paperwork accordingly.